When do women need a colposcopy screening? Have you ever wondered when a woman might need a colposcopy screening? This important procedure is not something every woman will need, but it plays a key role in women's health. Colposcopy is a follow-up test that helps doctors take a closer look at the cervix. It is typically recommended after initial cervical cancer screening tests show abnormal results. So, what triggers the need for a colposcopy? First, if a woman has an abnormal pap smear result, that can be a reason. For instance, results indicating a high-grade squamous intraepithelial lesion or atypical squamous cells that cannot exclude high-grade squamous intraepithelial lesion are significant. Persistent low-grade squamous intraepithelial lesions with risk factors also warrant further investigation. Another situation is when high-risk human papillomavirus testing comes back positive, especially for types 16 or 18. These types are strongly linked to an increased risk of cervical cancer. If a woman has atypical squamous cells of undetermined significance, along with positive high-risk human papillomavirus, that is another reason to consider a colposcopy. Additionally, if a woman has ongoing abnormal screening results over time, a colposcopy may be necessary to rule out precancerous or cancerous changes. Sometimes, a visible lesion on the cervix during a clinical exam needs a detailed assessment, and a colposcopy can help with that. During the colposcopy, the doctor uses a special instrument to magnify the cervix and apply acetic acid, which makes abnormal areas appear white. This helps in identifying where biopsies should be taken. The biopsies are then analyzed to determine if there are any precancerous changes present. Colposcopy is not a routine screening test but is reserved for specific cases based on guidelines from professional organizations. Women aged 21 to 65 should have regular cervical cancer screenings, and colposcopy is only for those with abnormal findings. Women younger than 21 or those who have had a hysterectomy without a history of high-grade lesions typically do not need this procedure. In summary, women need a colposcopy screening when their cervical cancer screening tests show abnormalities that requiring further evaluation. This process is essential for maintaining cervical health and ensuring timely management of any potential issues.